Okay, I'm a forensic nurse specialist in a high secure hospital, and I was a head of assessment. That means prison. I work in prison mostly, 18 years in prison service in UK. Um, I I work in with assessment of people who have been convicted uh, under the Mental Health Act, which is UK government, which is UK law, and then I do a brief work with immigration department to set up deportation detention camp where we help to. I was one of those people who helped to set up the mental health department uh, at Heathrow Airport, and then and as Ernest himself know, I'm a teacher, and also I'm approved sign of mentor. It's UK when you finish your training after your CIS, you have somebody like me who will sign off to the NMC that certified with my signature, and other people like me signature can say you are we trusted that you are competent, and you can enroll as a registered nurse before you get your PIN. Without a sign off mentor, you will not get your PIN, no matter how good you are in the universities. Sign off mentor are powerful than the lecturer, because they represent NMC to sign you off. And also, I started Save Life International. I've traveled nearly up to about 20 countries in Africa and most part of
Mm.
Europe,
Wow.
Malawi, Kenya, Uganda, Tanzania, no, name it. I've been, there to take the love of God, and because when I travel with, belongs to what they call Nurses International. So they are international nurses who are Christian Fellowship, Nurses Christian Fellowship International. So I've seen a lot of courage that I should bring God's love to people. So I started Save Life International, and we are in many countries in Nigeria. We are building our at the moment, and we are building 40 bedrooms accommodation for orphans and underprivileged children in Nigeria at the moment.
Wow. Wow. Wow.
Wow.
So that's what we are doing. We get sources from donation from friends, members of the church, and the public who help us to do the work we are doing. So that's me. I've been qualified as a nurse 28 years ago. I started with diploma, and then I went and do a diploma in nursing. That was our time. There was no degree, and then I did BSc in substance misuse and communicable disease, and then I went to do masters in forensic mental health. That's me.
Wow, that's fine. That's fine. We have from the statistics, we have mental health nurses who have also joined this seminar, and I know they will be inspired. They will be inspired. It is one area that in Africa we have not actually paid attention to, but I know for people like you, Alice, from today we will be inspired. So please, you can move on. Now we have come to know more about you. We have come to know more about Save Lives International. And like we said, the participants I know can follow you up from today for further advice and encouragement. I know. So please, you can move on with your presentation. You are talking about the psychological needs of the physically ill patient. How, as healthcare workers, we can meet the psychological needs of our patients. So you can move on.
Okay. Right. I just want to let us know, and wish we know as a nurse, that it is not just medicine, giving people medication that make them heal. Is also our attitude. And when I don't know about Ghana, though I come to Ghana regularly, but I've never worked in Ghana hospital. But in UK, we have what we call triage. When you pump into hospital or pump into your GP, we have a GP, we have a what we call primary care in UK, which is quite complicated to explain because of time. Um, you have your GP, which is based on the number of people living in area that you live. You register with the doctor, and then you see your doctor when you are ill. And after that, they can't do it. They refer you to hospital. Unless in emergency cases, you go to or out of hours, you go to hospital. You don't just pop into hospital in UK. You have to be referred, or less it's emergency. And emergency, you have to call 999 or call the paramedics and things like that. You know. So, but what I want to talk about psychological needs of physical ill patients is that it's more than just medicine. It needs psychological support when they come to hospital, from assessment to discharge. From my experience and from many inquiries that have been carried out in UK, we let them down. Nurses, doctors, psychologists, whoever, we let the patients down because we have not paid attention to their psychological needs. Right. I said that um, however, we must do more than just giving medication. You know, when we think about disease, we often limit our thoughts to the physical effects of disease on the body. We must not forget the emotional consequence that chronic illness and long-term treatment have both for patients. We know that many people react to medication. Many people couldn't take the medication because they are so big. I remember I used to work in the early days when the HIV started. Patients asked to use about 5, 6 medication combined, and which they must not miss. They must not miss that medication. You know, and some of them are so bogus, so big. You know, and some of them will pretend they use it, and consequently it will have effect because antiviral medication you cannot mix it. So what I say is that our support from the time of they enter our care is very important. We have to be contact. We know we have to have their baseline health, like a weight, their BMI, their vital signs, whether they have they have diabetes and all these things. So we have to have concern and also look at the loss of their body integrity. You know, some people lost weight, demonstrated that they cannot even come out of their home. We have to know that, and we have to look at we have to look at a different perspective of body image. How do people see themselves? You know, we have to have concern about that, because illness. The next one, the illness causes mental illness. For example, somebody who has a cancer, and you know, I work with cancer patients. Mostly, it's not the cancer that we treated, but we treat depression, anxiety. They think about what the end life will be. They lose weight. They lost their hair, especially women. You know, some of them, they have to do surgery for them. You know, and all these things we need to plan ahead, and also this can we mute ourselves, please? So and the physical health reduce autonomy in carrying out daily activities. So example, I don't know whether you guys have seen people who have a severe COVID. I've treated a patient with severe COVID. They develop mental illness, confusion, delirium, and then some of them have reduced body weight. They couldn't walk properly. So these are things that we need to to take notice of. How can we help them? How does this illness affect their psychological well-being? Some of them are the state of hopelessness. First thing they think, who is going to look after my children? If it is in UK, what do you think about your mortgage? What's going to happen to my house? What's going to happen to my family? What's going to happen about my job? So some people also, the acceptance of death, when the doctor came say, Lord, some people they gave up. State of hopelessness and economic fear due to loss of earning, especially where there's no, like Africa. In England, you can have a social security, they can pay your mortgage, they can give you your family some money. But in Africa, where there's no such facilities, how can we as a nurse help these people, talk to them? Bible talk about compassion. In Romans chapter 15, verse 5, I'm not going to read it, but you can write it down. Romans 15:5 says, may God, who gives you the same attitude of mind towards each other. So, God to give, as a nurses, we need to have compassionate care and compassionate mind towards our patients. Look, people are talking about they are afraid of death. Like one of my pastors said, everybody want to go to heaven, but we don't want to die. When they want to say that look, the prognosis is very, very bad, we can't help you anymore. You need just to go to hospice, or you need to go home, and your family has to, look after you. People have cancer, or terminal disease. So we need to know that we need to support these people. We need to have a care plan, how we can support them psychologically. And in UK, we have what they call national. We have a framework called National Service Framework, NSF. So in the NSF clause 6, it talks about the carer, that we need to do assessment of carer, their psychological well-being, people who are looking after the patients at home. What are their situation? What are their, how do they, care? What condition of health? So the psychologists, they have a lot of work to do. So because of time, I will not spend much time on that, but we must put in mind that we need to look at economic situation of our patients. It has to be in our care plan, the way they live, their family, their children, their work, and their physical. As we are looking after their body, also we need to do a care assessment of things that make their life one, because we are talking about holistic care. And in holistic care, you are not just talking about physical, you are talking about financial needs, family needs, and the spiritual need. I know Pastor Henry will talk about spiritual. Can we mute ourselves, please? Can we mute ourselves, please? So we are talking about spiritual. Some people, they hold on to God during the time of illness. So how can nurses operational help patients in recovery? This should be true holistic care, as I've said, physical care, psychological care, and spiritual care. Many people who are Christian, they want to go to church. They want us to call them a pastor, or whatever you call it in your country or wherever you are. But in UK, we have pastoral care. We have in the hospitals who will come and pray for patients. You ask them at the point of entry. You ask them, are you a Christian? Are you a Catholic? Are you a Pentecostal? Are you a Muslim? Are you not non-believer? So you can know how to take care of their spiritual. I know Pastor Harry will talk more about it, because he's a specialist on that area. He has his, he's a specialist. I will not go into the spiritual care, but it's part of the psychological input that we need to give to patients, so that from the mental health perspective, we need to know that illness. I'm not saying that when you bump your feet on the pavement, you straight away you have mental health. But if you are looking after somebody, you have to make sure that you look at their mental well-being, because chronic illness causes depression, cause anxiety, not only for the patient, also for the family as well. When somebody has cancer, immediately everybody think about death. You know, some people go to church and pray. Some people go to mosque and pray. Some people will not pray, they will be crying. But part of our job is to see whether we can refer them to psychiatric team. So it is important that we do that for our patient. So that is psychological support during the treatment that we need to do. Most especially, I want to leave this with you. Please, you need to treat your patients with dignity. Talk to them in respect. In Proverbs 31:25, for those of us who are Christian, those who are not Christian, I'm really sorry about it, but because Pastor Brother Ernest brought it in a Christian dimension, that's why I'm quoting Bible. So in Proverbs 31:25, it talks about strength and dignity and about so that we can encourage our patients. So part of the psychological input is that when you have compassion on your patient. That's why I brought the what they call, maybe you have heard about it before. Most of us might have had it. Those who train in England, I'm sure a lot of you read a lot of books. So you have what the chief nursing officer propounded in 20 around 2014, which they call CC. CC means that the care, compassion, courage, communication, commitment, competence, who are paramount and they are central plank of our profession. So in that area, in care, we talk about delivering high quality care is what the people need. People expect high quality care, not shabby. You cannot just treat your patient with a disrespectful manner. You need to make sure that the care you give to them is standard, and you uphold the. I don't know. I'm sure you have a nursing standard in Ghana, but you have to uphold to your nursing standard because NMC. We ask you in England whether if you go to inquiry, have you take care of your patient with dignity. We talk about compassion. Compassion, or Christian, as a Christian, we must have compassion, on one another. Either a Christian, Muslim, but on our patient, we must understand that most of them, they are. I look after somebody yesterday myself. This guy, I know he was a judge, but he was, because of his mental illness, that value, being a judge, has left him. But I need to treat him with respect and have compassion on him because he has a delirium. So we have to have compassion as a nurses, which is part of which can help the psychological well-being of our patient. We talk about competence, not that because you are qualified, that is the end of your study. Even though you are not going to university for masters, try to read some the latest research, evidence-based practice, try to increase your knowledge, try to bring new learning to your work, try to be a mentor. To be a mentor, you must acquire knowledge, you must acquire evidence-based practice, and which is quite important. And your communication, you can't just talk down on patient. It's no area as a nurse. No area. You can't abuse patient physically, verbally, financially, whatever. You can't talk. You can't talk derogatively to patients. I'm talking about UK, and I'm sure the same standard in Ghana. And being a Christian, we have to, Bible says, whatever we have our hands to do, we should do it well. We should know that we are working for God. We are not working for authority days, so that whatever money what we earn at a place of work, benefits us. So we are talking about courage. Nurses in England, it's not about money we earn. People think we earn a lot of money. No. Most of you nowadays, when I started with 16,000, which half of it go to tax tax and national insurance and some levy. And by the time I get home, there's no money left for me to pay my bills. So, and I have to look after people back home. So you are not doing nurses, you are not doing nursing job because of money, but you are doing it. Yeah, you earn money, but it's because of the compassionate, the love, and the care that you have for your patient. You go extra mile. When you go extra mile, patient notice that, oh, you are going extra mile for me. You are doing things that other people will not do. It doesn't mean that you patronize them. You can't patronize patients. It's not a good practice to patronize patients, but you go extra mile. Oh, do you need this? Can I do this for you? What can I do for you? And you talk, you do what other people will not do. The patients will notice you. The patients will recommend you, and you give them courage. Actually, through your attitude, they will have happiness and joy to recover. Our attitude as a nurse is very, very important. First, doctor, nurses, psychologists, and other professionals must build an environment of trust and therapeutic relationship that will help the patients process and accept their disease. Not that to say, oh, there's nothing I can do. And the doctor say you have only 3 days to live. You have can somebody please stop can you then mute, please? Can we
Please,
mute
please,
ourselves?
those who have you are giving us a very bad feed. Please, let's mute our microphones. Let's mute ourselves. We are disturbing. Please.
So we are talking about ourselves as professional healthcare professionals. We must build trust. In England, we have had a lot of inquiry about breach of trust. We had patients were abused, all kind of abuse, emotional abuse, financial abuse, and physical abuse. Calling people names. We can't call people names. We can't call people names. So please, these are the aspect. This must be based on our profession, and our work must be based on honesty, respect for the patient's choice. We must give patients choice. Gone are the days of paternity care. Paternalization means that you dictate to patient. No, you cannot dictate to patient. You have to work with patient and give them choice, give them dignity, and give them participation in their care. They own their own health. They own their body, So you cannot tell them, dictate their body to them. So once this important step has been taken, the psychologists also help the patients to develop strategy that allow him or her to live a full life expectancy despite of the disease. I know, and I have friends in the church and the community who they have told that that has a cancer, he has only 6 months, and he should go and prepare. The person, this is about 3 to 4 years now, the person is still alive. Maybe it's part of spiritual care, maybe because of attitude of nurses, maybe because of our own beliefs. But 6 months has turned to 3, 4 years now. So we need to help our patients to recover through our attitude, through our prevention, through our caring, through our honesty and dignity and compassionate care, which is very important. We are the front line. I don't know about Ghana. In UK, nurses, you remember, I want, if you don't get anything from this, I want you to take this down, write it down. You are advocate for your patient. I advocate for my patient. If the doctor say, oh, I research that medication. I know the side effect. I know the limit of that medication. So I can correct the doctors. I correct the doctors a lot. Say, no, sir, let's discuss about this medication for this patient. This is what the body weight, this is what you prescribe. This medication is too much. This can give this side effect. So you must know, you must be competent. What I'm saying, you must be competent in your work and be able to challenge status quo. So because you are advocate for your patients. So this give your patients, when you speak for your patients positively, this give their psychological well-being, psychological awareness, and they were able to, trust you. Because if you are in the position of trust, if patient trusts you, They can tell you what they don't tell the doctor. You can know more about them. You can know what affects their life. So please, because of the time, this subject is quite more important. But I want you to go from here to know that you are advocate for your patients, and also you must develop CC skill, which is care, compassion, courage, communication, commitment, competency. So they are central to our job. Thessalonians 5:11 talks about courage, and Romans 15:5 say, may God, who gives the same attitude and strength, give you strength towards each other. So I pray that God will help us to be a good nurses and able to be a representative for Christ wherever we are in our job. We'll be a representative of Christ for our patients, to our colleagues, and to our community and our country. God bless you all. If you have any question, I'm ready to take.
Thank you very much, Pastor Michael. I think we have learned enough. We have learned enough. You have inspired us this evening, at least with your experience, who you really are, some of the things you have done in the past, and so on. We are grateful. At least for nothing at all, I've come to realize that as a nurse or as a healthcare professional, I'm supposed to help meet the needs, the psychological needs of the patient, and we can only do that. We can only do that when we know the needs of the patient, that is the psychological needs of the patient. We have to make sure that we are indeed caring for the patients. We have to consider being compassionate also. We have to do this with courage as healthcare professionals. As you rightly said, we have to be courageous. We have to be courageous. You can only be courageous if you are on top of what you are doing. And so you have inspired us to read, even if we are not pursuing further courses. At least in our own small ways, we must read. We must learn to communicate with our patients. We must be committed with what we are doing, and also we have to be competent. You also left us with the word that we have to be advocates for our patients. That is a powerful word. We have to be advocates for our patients. You can't advocate for your patients if you yourself, you are not on top of your job. I have learned enough. We want to go on with the questions. Some people have left some questions in the chat sessions, and we want to find out from there and leave some of them with you so that you answer quickly. Okay, someone wants to find out. Someone, let's mute ourselves, please. If you have any question, because of the feed, that is why we are asking that we leave our questions in the chat session, please, so that I read them out for clarification. From Dominic Anyoka, he says, from the mental health perspective. Pastor Michael, please, are you around?
I'm around.
Okay, so from one of the participants, we want to find out that from the mental health perspective, our patients.
Sorry, Ernest, can somebody mute those who are talking or do something at the background? I can't hear a lot.
It's shocking that we are dealing with health professionals who don't have ears to hear.
It
Back
is
has continued
surprising.
for so long.
It is surprising. I don't know whether they are naive with regards to the use of Zoom. I know Zoom has been around for some time. Please, let's mute ourselves.
They've left it on. They are not in the room. That's why. Maybe. Yeah.
Please. If you do that, then we have to be mentioning names. Please. We don't want to be embarrassing anyone. Please, let's mute ourselves. Let's mute ourselves. You just enter, you mute yourself. Very simple instruction. Please. So Dominic wants to find out. It says, from the mental health perspective, are our patients or clients difficult, especially failing to meet their needs when they visit the health facility? Dominic wants to find out whether our patients are difficult when they think that we are not able to meet their needs when they visit the health facility. Then how do we manage such patients that sometimes we consider to be difficult patients, please?
Yes, I work in A&E, which is in England. A&E is the most difficult place that you can work because you have drug and alcohol, you have aggressive people, you have people that police. I work with the police anyway. I work with the people that police brought. We have what they call Section 136 of the Mental Health Act. People who are brought to the A&E, because they found them wanting and dangerous or behaving bizarrely on the street, or they arrest them somewhere. So the question that our brother is asking is that that's what I'm saying. You must have patience. You must have courage and your communication. Bible talks about communications a lot. That by your way of communicating with people, you can achieve a lot. When people, for example, in England, you have not seen an assault. You have not seen people. Yesterday, some people call me so terrible names because I couldn't meet their needs. But because I came down, the guy came down and hugged me and apologized publicly. Because that's why he has called me black this, black that, but if you go back to your country, fucking this. I was so calm. And because of the virtue of God, I said, I'm not going to answer this guy. But when I said, okay, come down, let's sit down and talk. When I explained to him, I talked to him calmly. I did not look at where he called me black, he called me this, he called me nigger, he called me all this. I didn't look at that. People who are there, they say, oh, you are so nice. They were recommending me in front of him because the way I dealt with it. So our attitude, our communication, our courage, our competency, will make us to be able to deal with difficult people. I'm part of the people who do interview for staff. Well, because I was a deputy manager in before. When we want to do, I always throw question to any applicant. How do you deal with a difficult patient and your difficult colleagues? Because you work with some difficult colleagues who will make your life hell. Who will make your life hell? How do you deal with them? So what I'm saying that go back to this. Go back to this CC and develop yourself. But honest, is it possible that we can send this CC out to people on WhatsApp? Because if you develop on yourself on CC, care, compassion.
Oh no, this one is not about this thing. No.
So
okay,
this one is no.
We will send them to the participant.
Yes. So if we can develop ourselves and you can build yourself on this CC core, we call it core of care, you will see that we'll be able to deal with a mental health patient. Because in Ghana there's no racism. Some people in England they hide under mental health to abuse you, to assault you because you are black. But that's not in Ghana. If you want to come to England, you must be able to be patient, be able to be tolerant, and because you can put yourself in trouble. That's what I will say. If not, if brother has more questions, he can WhatsApp me or WhatsApp. We are going to set up a WhatsApp group on this. We are going to set a WhatsApp group on this group on what we are doing today, so that we can answer questions and answer. You can answer some people who have no time to ask questions. If you have any questions regarding mental health, how to deal with it, please test me.
That's fine.
Okay?
That's fine.
I don't think I will.
Please, Juanita,
don't say. Please stop the noise.
Please, you either or you mute yourself, please. You can't join an online seminar and continue to do that, please. And someone who uses using an Infinite phone, Infinite Note 7, please, you have to mute yourself too. You are disturbing, please. You have a lot of people joining and you can't disturb all of us like that, please. So thank you very much, Pastor Michael, for that clarification. You have also given us the assurance that we can add you to our WhatsApp page. We will do that.
It appears that Sister Juanita doesn't want to ask me a question. Listen.
Juanita, do you have a question? Juanita Doche, do you have a question? I am not sure she's ready for anything like that,
Okay.
please. Yes. So thank you very much. For now, I don't know if you have some few questions also to
May you
add.
allow me, Mr. Moderator, to make a comment on one thing that my brother has said, the speaker.
Okay, that's okay. That's okay.
I don't know. When I was growing up, you hear statements like, "By the time I got to the hospital, I got better, even before I saw the doctor." And that was because those days you meet nurses who would triage you, and they will speak nicely to you, and they will do the if you like, do the initial physical ops and so on. And by the time you sit in front of the doctor, your symptoms seem to have disappeared. But it appears that the current day nursing practice in Ghana has a very bad press. And when our brother was talking, our speaker was speaking, those thoughts came to me. I thought I know the reasons, some of the reasons why nurses' morale is so low in Ghana. But perhaps if you're a Christian and you are a nurse, you have no excuse whatsoever. I think because people's psychological welfare needs are met, healing and care process go along with the people's psychological welfare.
Exactly.
People are feeling hopeless. People don't know what to do. And they are in the hands of nurses who are pushing them about, who are shouting at them because they ask questions. Then that is terrible. One of the ladies I wanted us to speak on here, but she wasn't able to do. Her mom died at Kolibu. She was tied to the bed, and that nurses did that. You see, so this is not my time to speak, and I'm not going to come back to this issue really hardly on banging hard on the head of nurses, but we need to be aware of that. Thank you.
Brother
Thank you
Pastor
very
Henry,
much,
I
Pastor
think,
Henry.
Pastor Henry, thank you very much. I think because of the time, we are going to do this seminar one way or the other again, because I want to talk about, next time we are going to talk about nurses' attitude. Thank God you are a manager before in England, but Pastor Henry, you know that a lot of people lost their pin because of attitude, because you cannot call patient names in England. You cannot, for example, yesterday, I talked to one senior nurse because she was angry and shouting at patient. I said, no, you cannot shout at patient, no matter what they do. You know what? Yes, I went to the same patient. I knelt down, instead of standing up, she was on the wheelchair. I knelt down near the chair and talked to her on that chair. She was crying. I thought I upset her, and she hugged me and held me. These are the patients who was talking to senior manager abusively. But because I was not standing on her, I came down, I sat down near the wheelchair, I knelt down with the wheelchair, telling her the process of why she has been. I will get angry. She has been A&E for complete 4 hours. She can see doctor going in, going out, nurses going in, going out. Why can't they attend to me? She said. And I have to tell her the process, what happened. This doctor is not a physician, it's a medicine. This one is a psychologist. This one is a physiotherapist. But they see us in uniform. They don't know who we are. They just see Dr. John, Dr. Michael, Dr. this. They don't know. So I have to come down. I didn't stand on her, talking to her. I came down, I knelt down near the wheelchair. As she was crying, and on the wheelchair, she hugged me. Why? Because of my compassion, because of my care, because of my communication with her. And she was able to wait. And I think that is what Pastor Henry was saying. We, as a Christian nurses, we represent God wherever we are. Remember, don't use your uniform to bully people. That's what I will say.
That's nice. Powerful message there. It is profound. We have the very last question. You have agreed to join our WhatsApp page, and so we are very grateful for that. After this seminar, we will add you to the page. We will add Auntie Sylvia, and then possibly I have to discuss this with Pastor Henry also. So we add you to the page. Then occasionally when we have questions and concerns, we will just post them there for clarification. We are looking at a situation where we will not disturb you with a lot of chat because we know you are very busy, just like ourselves also. We don't want to be disturbing each other. The very last question.
Sorry, Annette. People should not start sending morning greeting. We have had a lot. I will come out. Don't say good morning. The Holy Spirit.
Yeah.
No.
Yes,
Answer question is professional platform only for professional question and answer. Please.
Yes, I know. And I know the participants, I don't have to reiterate this. The participants have heard this clearly. When we add the resource persons to the WhatsApp group list, we are supposed to ask questions, learn from them, tap into their rich experience. That's why we want to add them to the page and not about pleasantries and so on, please. So the very last question is coming from Kletos Adongo. He wants to find out, he says, how do we as health workers manage our own difficulties as health workers, our psychological needs due to poor work environment, poor enumeration? I am sure he's trying to talk about remuneration rather, among others, because this can impact negatively on our health. So as healthcare workers, how do we also manage our own problems, our own psychological needs? So, Pastor Michael, this is the very last question to you.
Yeah. How do we meet our personal need?
Yes, our psychological needs, our own psychological needs from our own stresses and so on.
Yeah, I think in England, you see, as I've said, Ghana, Pastor Eric can help me out if I made a mistake. But in England, we have what they call supervision. We have a senior nurse. If you are band 5, if you are junior nurse, you have somebody who is higher than you. Who will be your supervisor? Who will be your mentor? We have a mentor as a practice, as a student. We also have somebody who supervises you. We do this supervision is compulsory in England. It's compulsory in NHS performance skill management. That if you are going through, because we are all carry a burden with us. We have marital issue, we have a children issue, we have financial issue, we have a extended family issue, that a burden that we carry to work. Is like a garment. You see, we carry it around. But many people get into trouble in England because of the stress they have in their marriage. The marriage is not going on well, their children is not doing well, or they are just coming from work, they are arrested by police, or they speed. They come out of home late, they are speeding, and they got the speed camera charges and the police after them. So when you come to work, you are panicking about the ticket, you are panicking about your work. So you transfer, which we call transferring skill behavior. You transfer that tension, that stress to your patient, to your colleagues. So what you need to do, find somebody that you their help to at work. You must have somebody. That's what I want to tell you. You must have somebody. It may not be in your department, but you must have somebody that you can talk to confidently, confidential, and talk to them. You trust them. You have to build trust with this person. That's I'm going through this. You know that they are your senior. Don't go to your junior. I'm not saying you don't go to your junior. If you are friends is different from a professional advice. Professional. So you can go to them and say, look, I'm going through this difficulty in my marriage or my home or in my health. I have a sister who just died. I was the first person that knew this sister has a cancer. She didn't tell anybody at work, even no manager. I was the one that knew. Praying for her, going to see her in hospital, they going to their house, share Bible with them. So you must have somebody. The sister has died now, but must have somebody at work who's your senior, or you look up to, that you can share your load with, and they can advise you, they can mentor you. It is very important. That's what we do in England. I don't know about. I preach this gospel to many nurses in Uganda, Kenya, Zimbabwe, Tanzania. When I go on the training, and even though when I went to Philippines, I preached that you must have somebody who will mentor you, who will be your supervisor, who will be able to listen and you sign confidential statement. We do that in England. Whatever we say here is confidential and end up in this room. Okay, that's what I
Okay,
would say.
that is fine. That is fine. I think so. This answers
Pastor
the
Henry, please. Pastor Henry can a little bit contribute.
Mr. Moderator, okay, thank you, Pastor Michael. The little bit I will add because of time, and your time particularly, is that yes, there are system issues. The question is a very broad one, but part of it is systemic. The corruption in Ghana smells to the highest heaven, and maybe I lived in Nigeria as well. But Pastor Michael may have something to say about that, but we're not going to go into that much. And we only cover our faces with religion and jumping up and down from one church or the other. And yet a lot of us carry problems that, like he said earlier on, we project them onto our patients because we are not happy. But a lot of us are not professionally accountable. And we do what we want to, we like, and we ask God's blessing on top of it all. And these things don't work like that. But yes, indeed, the system, I started by saying that because if the system is working very well, it's not going to be difficult to have a support and supervision system or network within the system. Your problem starts, first of all, from the ministry, where you can work for 1 year, 6 months without your first pay. And people sit there and they are being paid, and you go and bribe them before they pay you, and so on and so forth. So there's a lot of huge financial problem there that people carry with them. But I think overall, what this is projecting is, and I'm glad this question came up in terms of, and when Sister Sylvia and I were speaking about it, we're thinking also that this care thing is not just about the patients, but about the caring for the health professionals, caring for our own well-being and making sure that we are well enough to look after. And so psychologically, we need to be up to the task, the daily task that we come to. Somebody can come to work at 11 when he's supposed to start at 7. Patients are waiting. And because they're busy solving their own personal problem, and it doesn't help the system. I want to stop that, okay? I want to stop here, rather. Thank you.
Thank you very much, Pastor Henry. I think the statement that Pastor Michael ended with, in the UK, it's applicable and very easy to achieve, so to say. I think some of my colleagues have concerns with that. Some are raising concerns about sharing information with colleagues and so on, signing consent to that, etc. I think we would get enough time to talk about that when we add him to the WhatsApp page. So those who are on the page don't get
Ernest, just a minute before Pastor Eric took over.
Okay.
In England, you see, I used to be, which I know Pastor Henry also the same. Yeah, is on the same platform with me. I used to be the head of a group that we call union in my place of work. Okay, this girl just came to England after their practice. I think it's about a year and a half, and she was struck off by NMC. Why? She was, you know the way we shout. She was shouting on the patient, and and at the end of the day, she was had to be reported. Actually, so what I'm trying to say, if in England you have people, if you have a supervisor, you have a mentor, you sign confidential. Confidential is confidential. If you breach confidentiality information, you go to jail. You go to jail. I'm telling you, you go to a long-time jail. You will lose your PIN number, and you may be actually be deported. Because confidential information of a patient, of your colleague, of your hospital, like yesterday, somebody say, "Oh, name this person." I say, I will never. Because that person's confidential is important to me, because they can sue you. But I think we need to change Africa. We that coming home, we need to do this constant training and able to say, because if I trusted you as my senior, I share my colleague, my problem with you, and you divide that information to third party, I have the right to sue you. I have the right to sue you. So there must be a shrine in the constitution on the law of a country that confidential information is confidential information. You must not, either your patient, your colleagues, or your nation, or whoever. It's like treason and felony. Sorry, I'll stop there. Pastor Eddie needs to take over.
That's fine.
God bless you.
That's fine. Pastor Michael, that is fine. I think we are learning. And so, as you are saying, we have to share our own problems with each other. We should trust each other. And if we think that we have doubts or trust issues, we can just sign consents and then share our. Because if you try to keep the problems, in the end, it may come back to haunt us and then clear us off. We have learned a lot about the psychological needs of the patient today and how we can also help meet those needs of our patients as healthcare workers. We have talked about, before Pastor Michael spoke, we heard from Auntie Sylvia, who talked about physical needs and care of the patient in our quest to achieving a holistic care of the patient. We would go on to the next speaker, that is Pastor Henry. He will be talking about the spiritual needs or care of the patient. Our patients need some kind of spiritual care from us as healthcare professionals, as physicians, as physician assistants, as nurses. Our patients need that from us. And so we move on quickly to Pastor Henry as he shares his with us.